Hi, my name is Kiana, and for this infomercial, I will be discussing the effects, risks, and consequences associated with the drug nicotine. Nicotine is the highly addictive drug found in most tobacco products. These products include cigarettes, e-cigarettes, chewing tobacco, and hookah. What most people do not realize is that nicotine can be as addictive as heroin, cocaine, and alcohol. I wanted to provide some statistics that I found from the Centers of Disease Control and Prevention. Firstly, tobacco use is the leading cause of preventable death in the United States. More than 7 million people die each year from tobacco use. More than 16 million people are living with the disease associated to smoking or tobacco use. Lastly, on average, smokers die 10 years earlier in comparison to non-smokers. Now I will go into the immediate effects of nicotine on the brain. When nicotine first enters the body, it begins a series of chain reactions. The adrenal glands start to produce great amounts of adrenaline into the system, which elevates the heart rate and normal breathing. The rush of adrenaline can also cause high blood sugar. This explains why individuals tend to not be so hungry after they smoke a cigarette. Lastly, the reason why individuals enjoy smoking so much is because vast amount of dopamine is being released in the brain. This causes the individual to feel good and pleasure. Moving forward, I will talk about the effects of nicotine on the body's different systems. Starting with the central nervous system, nicotine can make one feel dizziness, lightheadedness, experiences with abnormal sleep disturbances, and headaches. The effects on the cardiovascular system include aortic enlargement and dissection, or tears in the heart, increased clotting, heart rate fluctuation, and increased blood pressure. These effects can lead to further complications such as tachycardia, stroke, and hypertension. Nicotine can cause insufficient blood flow to certain organs in the body, such as the kidneys, stomach, arms, legs, and feet. The effects on the respiratory system include shortness of breath and bronchospasm. Bronchospasm is the sudden constriction of the muscles in the walls of the bronchioles. It causes mild to severe complications for breathing. In this segment of the presentation, I will discuss the risks associated with nicotine. I will be highlighting nicotine addiction, nicotine withdrawal, as well as other lifelong health complications. These are the symptoms one experiences when dealing with nicotine addiction. As stated earlier in the presentation, nicotine releases vast amount of dopamine, which will cause the individual to experience pleasure. This includes reduced anxiety and stress relief. After constant nicotine use, one will have constant tobacco cravings. They'll begin to try to get their hands on any tobacco products or nicotine devices. They will start to feel anxious or irritable if they don't feel the effects of nicotine. Lastly, they will continue to purchase tobacco products regardless of the health risks. Addiction can lead to withdrawals. Withdrawals are the physical or mental symptoms that occur after stopping or reducing the intake of a particular drug. These are the withdrawal symptoms from nicotine addiction. I also wanted to mention the negative health risks associated with nicotine usage among pregnant women. Nicotine causes interferences in the development of the fetus's brain and lungs. It can also cause sudden infant death syndrome. Sudden infant death syndrome is the unexplained death, usually during sleep, of a seemingly healthy baby less than a year old. Other nicotine effects on the baby include low birth weight, preterm delivery, which is a birth that takes place more than 3 weeks before the baby's estimated due date, and stillbirth, which is fetal death. Another topic that I wanted to focus on is the nicotine risks among youth and young adults. The three main health risks of nicotine on youth and young adults are memory issues, learning complications, and having difficulty paying attention or concentrating. Teens and young adults are sensitive to the addictive effects of nicotine because their brains are still developing. At a young age, nicotine can rewire one's brain, which can lead them to trying more addictive drugs. Finally, I will discuss the consequences of nicotine. These are the common diseases associated with tobacco and nicotine use. First, we have lung cancer. Next, we have emphysema, which is a condition where the air sacs of the lungs are damaged and enlarged, causing breathlessness. Then, chronic bronchitis. This is a condition where the inflamed bronchial tubes produce a lot of mucus. This leads to coughing and difficulty breathing. And the last few common conditions associated with nicotine are leukemia, heart disease, and stroke. In today's infomercial, we discuss the effects, risks, and consequences of nicotine. We also discussed the effects of nicotine among pregnant women, teenagers, and young adults. Thanks for watching, and I hope that you all learned something new from this video.